most ladies, most men will not be allowed. And this is a clear barrier. Most men already face it. And the second biggest barrier, which apart from the healthcare policy, is the negligence. Most men in Uganda do not care. Either they think that it's the responsibility of the mother to take care of the pregnancy and they stay at home. But I would like to outline these few benefits which studies have proven, which you can always find on internet, on PubMed, on Google Scholar, about what are the duties, what are the healthcare benefits of a man moving with his wife right from day one of conception up to the birth of a child. First of all, there are three delays which have been identified that have led to continuous maternal deaths in Uganda. One is delay in making a decision to leave home. Usually, men play a big role to allow these mothers to leave home in case of an emergency, in case of a complication. The second delay is in transportation, which men feel would play a good role, the fact that they are heads of the family and they play a role in the community awareness. And three is a delay at to receive the healthcare service when they reach the facility. So the first delay is a very big one, and it's really directly or indirectly is to do with men. So the first advantage is when you escort your wife, there is a whole package of antenatal care services which is given from day one up to the ninth month of pregnancy, which does not only go to the man, to the woman, but also to the man. For example, HIV services. You can all have your HIV testing, and in case one of you is positive, it will help uh, reduce the disclosure issues, because in that case the child who is to be born will immediately start on the therapy, prophylaxis therapy. Two, uh, the man will act as a support system for the woman. If you all visit the doctor and the lady say is anemic or is having high blood pressure, the doctor is going to prescribe some food remedies for you, home remedies. For example, reduce on the amount of salt, take a lot of water, take a lot of greens and vegetables, and all these will to be a duty of the man to take a step further when they reach home, and also to identify the warning signs, the risk factors. For example, they will tell you that if a lady has preeclampsia toxemia, that is high blood pressure, she usually gets frontal headache, epigastric pain, and lower limb swelling. If you're a man who had escorted your wife to the hospital, you can easily identify these and you can react and answer immediately. So, in